Good morning. My name is Talbot Brooks, and I represent the UN SPIDER North America Regional Support Office. I'm also the director of the Center for Interdisciplinary Geospatial Information Technologies at Delta State University. As I think everybody's familiar, COVID-19 poses some very unique challenges to space-based disaster response, and this truly is a disaster that we are responding to. So session 2 today is going to address space technology contributions during the pandemic. There will be a total of 6 presentations. I'm very pleased to introduce Dr. Wang Yang from the Institute of Geographical Sciences and Natural Resources Research at the Chinese Academy of Sciences. His presentation today will be applications of space-based infectious disease detection models and enlightenment for COVID-19 control. Please join me in welcoming Dr. Yang, and we will hold all questions at today's session until the end. Let's give each presenter 15 to 20 minutes, and then we'll make sure we have about 15 to 20 minutes to wrap it up with questions. Thank you, Dr. Yang. It's all yours.
Dr. Yang, we can't hear you. Can you unmute and speak?
I'm Yong Wang from Institute of Geography, Science and Natural Resource Research, Chinese Academy of Science. Today, I would like to share with you the research results of our team in recent years. Application of space-based infectious disease detection models and enlightenment for COVID-19 control. The next, please select. The report expands from the following 4 aspects. The first aspect, the background, as it is known to all, Chinese has made remarkable achievements in disease prevention and control since 1979. For example, a joint prevention and control mechanism has been established. Many infectious diseases like AIDS, schistosomiasis, tuberculosis has been effectively brought under control. Yet, we still face service challenges because the outbreak and prevalence infectious disease is still in serious situation. Old infectious diseases are still spreading, and new infectious diseases continue to emerge. For example, in China, SARS emerged in 2003. Bird flu appeared in 2004, 2009, and 2013. And the MERS emerged in 2015. Please next. With the advancement and space-based technology in recent years, global position system and remote sensing has assisted in accumulation of large numbers of infectious disease-related monitoring data, and GIS-related analysis methods and models have been continuously improved, and the temporal and spatial distribution of infectious disease has greatly received widespread attention, helps in deep understanding of cause of disease, and assistance in design making and related disease prevention and control. Next. Please next. As you know, infectious disease-related environment has both temporal and spatial characters. Based on these spatial temporal characters, we can reveal epidemic process of infectious disease. But how to reveal That is, we need to space-based infectious disease detect model. Next. To build the model, first, we need to understand the relationship between independent variables and dependent variables. That is, the relationship between the y and x. In general, there's multiple relationships between y and x. For example, linear relationship, fixed nonlinear relationship, etc. Second, on basis of analysis the date according to the relationship between y and x, we can establish the spatial temporal model. There are many methods to build the model. For example, the class linear regression, spatial linear regression, geographical weighted regression, geodetector Q, etc. Next, we will introduce the 3 different level models, which are the best of our study. The first level model, ordinary least square regression, that's OLS. OLS is the most basic model to study the spatial temporal model of infectious disease, which is suitable for all observation objects that do not change with geographic location. In fact, the vast majority of infectious disease are closely related to spatial location. For example, COVID-19, as the positive of infectious person moves, it can spread in large number. Obviously, to solve the spatial spread infectious disease, we need a new approach. Please next. Second level model, geographical weighted regression model, that is GWR. Actually, GWR model is a special extension of OLS model. The research object changes with the geographic location of the regression parameters, yet different spatial positions have different weight. How to decrease the influence of different location on research object is we use distance weight OLS method. Next, OLS method like this. The core of OLS is that the closer to the object of study, the greater the influence and the weight. Okay, here now. We have solved the problem that object study is affected by the spatial position and degree of influence different spatial position, but we still have key points need to be resolved, like is there interaction between the subjects who are the main influence factors and so forth. So we need a third level model. Next. Please next. That is your detector model. This model was proposed by Professor Jingfeng Wang, one famous researcher in our institute. I led my team to deepen and adapt this model to the field of infectious disease. Geodetector is used to detect spatial differencing, to detect explanatory factors, and to analyze interaction between variables. Geodetector include 4 paths: risk detector, factor detector, ecological detector, and interaction detector. Among them, risk detector mainly expose the location of the risk area. Factors detector is used to identify what factors are causing the risk. Ecological detector mainly explain the relative importance of risk. literature can explain whether influence factors act independently or interact. The biggest advance of this method is that there are no too many assumptions and it can effectively overcome the limitation of traditional statistics analysis methods in dealing with category libraries. Please next. The third aspect, I will share a research result of our team in recent years by using 3 different level models, including dengue fever, schistosomiasis, plague, and COVID-19. Today, due to the time constraint, I just talk about dengue fever and COVID-19. Please next. The first research on dengue fever mainly starts from a relationship between social environment factors and incidence of dengue fever. The study area is Pearl River Delta region of China. We short for PRD. Please next. Compared to previous study, we conduct this study at the village level, and the impact of natural factors and social economic factors on incidence dengue fever is analyzed, including distribution range, urban rural area, population density, gross domestic product, that's GDP, road network density, and vegetation coverage. Please next. We also use GM model to probe the affections. Please next. To further study the effect of social, economic, environment factors on the spatial genetic of dengue fever, we used detector method in the serious areas, Guangzhou City. Look at the map. Yes, Guangzhou City. Please next. We carried out spatial temporal scanning statistics. The results shows that the high-risk periods in Guangzhou City was from September to October. There's a high incidency rate in the central area of this city and no incidency in other regions. Please next. And use GM model to build a spatial temporal relation equation between the members case and the 6 factors. And the result shows the junction of central distribution of Guangzhou is high-risk area with urban village and urban rural fringe zone formed by urbanization as important regional effect. The low GDP, the high population density, the high road density were as the risk factors. Please next. From the above research, we have 2 points of enlightenment. First, space-based research results are helpful for the prevention and control dengue fever. Devote more research to urban villages and urban rural fringe areas with no GDP, no NDVI, and high road density. Second, please next. Second, the country can learn from China experience. The extension of this study to the other cities that have experienced serious epidemics will help design effective control measures. Please next. Now we will talk about China's response to COVID-19. China's response to COVID-19 relied on space-based technology. Please next. Rapid construction of big data information system for epidemics and the spatial tracking and the spatial temporal tragicity played a key role. Please next. Spatial segment of epidemic risk and prevention never helped persistence, preventing, and control. And please next. Spatial dynamic balancing of supply and the demand for medical resource contributes to analyze dynamic situation of medical protective equipment across the country. Please next. The severity of epidemic in each province was highly correlated with the population who traveled there from Wuhan before the city of Wuhan was locked down. The result, please see the maps. Please next. We have got important enlightenment, that is, state and method support is very important. Please next. More mechanism research is needed. Includes impact factor in exploration and disease transmission mechanism. Please next. How to apply theory to practice is also very important and necessary. Please next. The Enlightenment, Chinese Enlightenment, I think it can be shared to the other countries. Okay, that's all. Thank you for listening and happy Thanksgiving.
Thank you, Dr. Yang. That's a very interesting presentation. Again, we'll take some questions at the end. So if you'll please not go too far, we will come back. Emma, if you're ready, I have a presentation to share.
Good morning, Talbot. This is Jim Hagan. I just wanted to let you know that I am alive and well and here.
Well, then you get to become the moderator now that the technical issues have been resolved. The show is all yours.
Well, then our next speaker is Professor Talbot Brooks, Director for the Center for Interdisciplinary Geospatial Information Technologies at Delta State University. He will speak to us today on the ethical use of space-based technology for disaster management. Take it away.
Thank you very much. Emma, the next slide, please. One of the things that I've come to realize through experience is that just because we can do something doesn't necessarily mean that we should. And that holds true for many reasons, but the one I want to talk about today has to do with ethics. So next slide, please. So a brief overview of this morning's presentation, and I want to be clear, because I'm talking about ethics in particular, is I want to foster and generate conversation, dialogue. This is not to point fingers or say what's being done correctly or incorrectly. It's just something that I think that we as a larger community need to talk about a bit more. And that COVID-19 and the space-based response to this pandemic provide some insight as to the direction the conversation might need to take. I will try to highlight some challenges then that bring these ethical issues into focus, and then perhaps share some questions for later discussion in this session that we can undertake as a group. So next slide, please. I think one of the more interesting pieces of literature to be published about the application of space-based technologies originated in 2015, and it was published in Scientific Reports. It's part of the Nature Science conglomeration of publications. And the authors postulated that using high-resolution satellite imagery to monitor traffic near hospitals could be used as early indicators or tracking, in this instance, flu and how it was spreading, particularly in Chile, Argentina, and Mexico. And so they were looking at and trying to correlate the case counts associated with disease development in these areas with traffic patterns around hospitals. And next slide. This shows, you'll see here, a very interesting, next slide. Yeah, you have it, the pictures, yep. This slide shows how they were looking at the fullness of parking lots and traffic on the streets at various times of day to see how busy hospitals were. The case on the left is one that was accepted and used in their modeling efforts, and the one on the right was discarded because the imagery had a large shadow in it. So time of day and other factors definitely influenced the collection of the data. But this got me thinking about, geez, I wonder if anybody is looking at this problem set using this approach for COVID. And next slide, please. And in fact, they are. Harvard dived headfirst into this, and they have published a paper. The citable links are available there on screen. And this really fascinated me because I think that it's a very valid approach for early warning and detection, a spectacular use of space-based technologies. But then I listened to some of the not very positive media attention this was garnering here in the United States. There was blame being assigned to Asian populations and a lot of castigation going on. And I thought back to other outbreaks of disease that have gathered the world's attention for good reason. For example, AIDS and HIV, as it emerged in the 80s, people were terrified of it. There was a lot of violence against homosexual people because of that disease. And so I started thinking, boy, if we're monitoring using high resolution, high temporal rate imagery from space, we like to think that the methods that we're creating and deriving are used for good purposes, but ethically, who is examining whether or not we're doing the right thing? How are we protecting groups that may actually be at risk? So next slide, please. And so I looked at the CDC data here in the Center for Disease Control data here in the United States, and that's shown in the table at right. And if we're going to be afraid of vectors, people that may transmit the disease, for example, the data is very clear that American Indian and non-Hispanic Native populations are experiencing much higher caseloads and their hospitalization and death rates are also much, much higher. And so there's this plethora of ethnicity data that's associated. And again, I just was wondering, boy, I can see cases where we could use the space-based technologies and fuse it with census data and the location of hospitals and identify and remedy underserved areas. But I could also see political leadership that or groups with not very good intent using the same type of approach to starve areas that need these types of treatments, to use our technologies for bad instead of good. So next slide, please. So I worked at trying to think through just some very basic cases, some examples, some ways we perhaps need to start thinking about our work, particularly with high resolution, high temporal collection and the fusion with other data sets and what have you. And it's really a watershed moment for us because, and I'll mention this again later, I want to reinforce the point. I think there was a lot of awareness generated by the application of satellite imagery for things like damage assessment in the early 2000s, and that created awareness about the potential for using space-based technologies for disaster response. And that revolution that occurred took our work and introduced it to mainstream disaster management. It was a watershed moment, a very big change. But then we've been relatively low profile for the 15 years or so since then. But now, with these techniques that are being shown using very, very rapid collection rates, very high resolution, 15 centimeter resolution from space, this type of ability, and then its linkage with a wide variety of underlying factors, such as what Dr. Yang showed in the modeling efforts. Well, this is another really big deal. It's raising tremendous awareness about the power of geospatial. And I think there's a couple of problems that go with it that we may not understand very well. The first is the potential for information overload or saturation is a massive, massive risk. We need to remember those that we're serving are not necessarily experts. They don't understand, as shown in the earlier example, the implication of a shadow in that parking lot. I think sometimes for us as geospatial professionals, there's a temptation to let the technology do the work for us. And we tend to forget that platform and sensor and computing technologies don't substitute for the human touch, for our own expertise to be able to look at and think about some of the implications associated with working with these data, which leads to the next point that I have. Unfortunately, there's a movement towards the death of expertise. Everybody in the world that has Google has become an expert in simulation modeling, mRNA transcription in viruses, and vector models for transmission in geospatial technologies. Unfortunately, that's not really the truth, right? So we need to understand how to message and be heard above that noise to gain some confidence and get people listening to us as the experts. And as we do that, keep in mind that we have our own limitations. For example, I'm a bit uncomfortable talking about ethics today because this isn't my subject matter of expertise. I'm broaching this with colleagues as something maybe we can start talking about more as a group and maybe involve some experts in ethics to help us explore some of these things. But we're good-hearted people that want to solve the problem. And so sometimes I think, at least speaking for myself, in trying to help and trying to do the right thing, I may overreach into areas that I probably shouldn't. So next slide, please. And I also realized that the potential for doing harm is far more significant than perhaps we realize, because the space-based imagery that we collect as part of a disaster response doesn't discriminate as to who the good guy or the perceived bad guy is when the disaster strikes. This is particularly true in areas that may be undergoing conflict as a disaster occurs, and that makes them ripe for the abuse of space-based imaging. For example, what's the potential to abuse drought monitoring, or if there were, and it's in an earthquake threat zone in northeastern Ethiopia, if there were a major earthquake there and we had an activation and collected all kinds of data, what is the implication for collecting and sharing that data, even for humanitarian purposes, now that there is a conflict building? Or even less nefarious, perhaps, is how are the recent elections in the U.S. potentially affected by imagery that might have been collected for COVID-19 surveillance? I don't know. I don't have answers to any of these things, but I think we need to discuss them. So a last kind of thing about vulnerable and at-risk populations. Is there awareness among the commercial and different government sectors about, and do they have an equitable stake in the ethical collection and distribution of products and services? So next slide, please. There are some other considerations, two more that I'll cover. Data fusion. I got thinking about this, and space-based imagery collected by the Charter or for any disaster-based purposes can be recombined with nearly any data set in today's day and age. And I got wondering, and I don't have the answer, are there certain use cases where the provision of high resolution or timely satellite-based data proves to be the key that unlocks or plays a pivotal role in uniting or enabling an unethical or harmful application, especially if the data are in the wrong hands? And how do we weigh as a community whether or not the collection and distribution of data is doing more harm or has the potential to do more harm than good? How do we weigh and measure such things? Next slide, please. And then lastly, just briefly, there are licensing and intellectual property issues. UN Spider does a pretty good job of trying to talk to licensing and intellectual property issues, but how do we educate our downstream users once the map or the data may leave this body of experts? Is competition inadvertently created among imagery providers to try to, and perhaps this is a good thing, to get things out and distributed faster? And are there potential compromises of intellectual property rights as a result? How long is intellectual property or the copyright on a data set maintained if it's volunteered and given out through UN Spiders? And what are the standards for source referencing in maps and data services that use international charter data? Is that set by the country making the donation of the data or the map? Is it up to the distributor? It's a very complex system, right? So perhaps this is something else that we need to consider. Next slide, please. And then lastly, qualifications and equity. I think that when we're using geospatial technologies in support of disaster, people's lives are at risk at the other end of our pipeline. Those users may go into harm's way based on a product or data that we have created and shared. But what are the qualifications that we require then for the people working for us? And what are the quality assurance standards that we refer to so that we get it right and don't ultimately jeopardize somebody else's life because somebody unqualified or not well trained was involved in the pipeline of geospatial data collection and processing that we do. And then I realized also, and somewhat disconnected, that the humanitarian geospatial community relies very, very heavily on volunteers. And I couldn't help notice after some recent efforts to provide support, say in Nepal, and is I think a good example, that before the disaster occurred, there was nothing on the map. Some of these regions were very large blank spaces, and using the power of crowdsourcing and donated imagery and things like that, you can look at how the map literally changed over the space of 2 weeks as all of those missing features got filled in through huge volunteer efforts and donated services from organizations like OpenStreetMap. But a year or two later, you see variations, at least, of that crowdsourced data being sold back to the company that, or the country that suffered the disaster in the first place. And so is there some exploitation going on here that we might need to think about? Again, I don't know. I don't have an answer. I'm not making accusations. The point of this presentation is to raise and discuss some of the ethical issues that I think we need to have conversations about. Next slide, please. So I would leave these for discussion later in the session, but ask, is there a need to formulate a clear statement on ethics and include it in work agreements and processes, training, and outreach efforts conducted by our community? Is there a need to introduce neutral experts, say, with expertise in regional cultural geography to ensure that products and services that we might release in hopes of helping a disaster don't compromise an at-risk population due to some conflict where, as the space-based technical experts, we may not be aware of? What mechanisms can be created to help improve ethical conduct within our community and those communities whom we serve? What training can we build and distribute through UN Spider in the area of ethical applications of space-based technologies for disaster? Are there other things that fall into this issue of ethics that I'm not addressing in this presentation today? Again, I'm not the expert and would love to have other ideas. Next slide, please. So I'll leave you with this, kind of some closing thoughts, that COVID-19 is a very much a milestone application for geospatial technology and disaster response. I think we started with Hurricane Katrina, really introduced the benefits of electro-optical remote sensing to show the extent of damage post-event. But coronavirus is another very pivotal landmark occurrence in our field because it's showing, okay, now this just isn't about pictures. There are all of these other types of fancy space-based data that can be collected, and they can be fused up, they can be matched up with any number of other data sources to create elaborate disease models or predictions. And I think that awareness is come about very, very quickly. So this is a pivotal moment. And because we're in this moment now where there is tremendous awareness, I think examining the use of space-based and geospatial technologies to combat plagues and other problems, the moment is now for us to have a discussion about ethics, and that the international nature of UN Spider provides an ideal forum for this type of discussion. So that's my 2 cents, and thank you for your time, attention, and I turn it back to Professor Hagen.
Thank you so much, Professor Brooks, for an incredibly thought-provoking presentation. We will come back at the end of the session, hopefully, for some questions on your materials. I am Jim Hagen. I apologize for my early technical difficulties. I'm currently Professor of Public Health and Disaster Management and the former Regional Director for North America of the International Emergency Management Society. It's my pleasure to be here this morning. If you could pull up my slides, I will be your next speaker. My talk this morning will deal specifically with societal disruption as a result of epidemics, pandemics in the past, and certainly with COVID-19. Next slide, please. The history of our world for thousands of years has been punctuated by earth-changing epidemics and pandemics. A wide range of viruses and microbes of all types have repeatedly ravaged populations. We know that each time, society has been radically disrupted. This can take many forms: economic, job loss, cessation of educational efforts, mental health issues, political disruption, and religious disruption, stopping of sporting events, and affecting all of our vulnerable populations disproportionately. We are all familiar, unfortunately, with the quarantine and isolation associated with this type of occurrence. No question, our lives have been upended. Next slide. Unfortunately, we see not only disruption, but unrest and even violence. It has been noted that to different degrees, most of the great epidemics have been incubators of social unrest. Next slide, please. Normalcy is gone during epidemics. Clashes, even violence, breakouts between states, governments, and citizens, eroding of state capacity and trust, socioeconomic crisis and inequity increase both social tension and discrimination. Next slide. All nations have and will continue to have vulnerable populations. This includes those in poverty and older populations. Our older population is becoming much older with many chronic conditions. They are heavily medicated and rely extensively on the medical community. Of course, the number of those who are disabled with mental health issues are also rising. A new vulnerable population could be called the long haulers. This refers to those who have had COVID-19 and recovered, but continue to have long-term effects, most of which we are only now beginning to recognize. Next slide. Epidemics and pandemics have always caused social and political unrest. However, we in the United States have never been more politically divided than we are right now. As you are probably aware, there has been controversy over who our new leader would even be. Controversy and violence continues, and I fear it is not over yet. This division has been caused in large part by the pandemic. How do you allow a deadly pandemic to become so incredibly politicized? Logical public health measures to take during a time without antivirals and vaccines are being undermined. Denial of the pandemic has been a political statement. Next slide. In this pandemic world, it is illustrative to compare COVID-19 in our modern world to pandemics of the past. When one looks, there really isn't much difference between how we are now responding and how we responded in the past. Without antivirals and vaccines, we are forced to again use societal responses: masks, social distancing, and hand washing. And once again, our most vulnerable populations are disproportionately affected. Next slide. Despite the lack of antivirals and vaccines in both cases, there are some differences. For the most part, at least currently, those who are ill can receive hospital care by trained professionals and have advanced supportive care available to them. Of course, in our current times, we are having overwhelming numbers of cases, and that may not be true much longer, especially with our holiday seasons. Unfortunately, this all continues to evolve as the number of cases increases. Next slide. Other very interesting comparisons can be made, such as the activities of what was called the Anti-Mask Society during the 1918 flu epidemic. It is interesting if one goes to the internet to see what happened during that time frame. Next slide. There were populations then and now who actively resist or deny the use of masks to protect themselves and the rest of the population. We see that certainly even today. Next slide. In the earlier epidemic, those who resisted used to be thrown in jail for the refusal, but there was a more universal acceptance of the need for masks. Next slide. It is extremely interesting that for the 10 years before COVID-19, many of us were deeply involved in creating plans, playbooks, and even holding exercises to test our plans against infectious disease outbreaks. The coronavirus was one of those we most feared. For example, this is a playbook created during the Obama administration in the United States and passed on to President Trump. Even more startling, the United States had a functional exercise called Crimson Contagion in 2019 to test our novel virus pandemic plan. What happened? Next slide. Why didn't the United States plan work? It was a playbook. Better put, why did it fail so miserably? Here you see some of the reasons. Over the years, our public health monies had been drastically cut since they were apparently not needed. Unfortunately, a lack of a crisis lulls us into a false sense of security. Our response was slow. No progress was made on vaccines, although they had been conceived. And there was government denial and political polarization. The playbook was not even followed. Next slide. I'm going to skip this slide since other speakers are spending a good deal of time talking about how we can track, predict, and respond to epidemics and pandemics through our space resources. Next slide, please, Emma. Have we truly learned any lessons? Or are they just the same lessons over and over that we never learn? Let me highlight a few. First, human health and the health of the planet are inextricably linked. The planet will take care of itself, but as we harm the planet, so the human race is at risk as well. We know that COVID-19 can sicken and kill anyone. Next slide. We know that infectious disease outbreaks will continue to happen. As our environment is altered, the conditions are more favorable to this type of thing happening. Viruses are extremely capable of mutation and change. As we stress our planet, unexpected and deadly results will occur. Part of the effect will always be social disruption. If we have a playbook, we should really use it. We must formalize our process for rapid vaccine production for when it will be needed again. And then last, global communication and cooperation are vital, as are testing and contact tracing. Next slide, please. I, like everyone, is more than excited that vaccines appear to be literally weeks away, vast quantities of them and different types. But we are not there yet, and it will take time once they become distributed to get to everyone. I entreat people to not weaken your resolve. Do not stop using public health measures. We are so very close, but not there quite yet. Thank you. All right, as I and Professor Brooks mentioned earlier, we'll take questions at the end of our session today. I would like to introduce our next speaker this morning, or this evening. The speaker is Isabelle Duveau-Béchamp, Head of the Member States Relations and Partnerships Office, European Space Agency. She will address the topic of space programs and technologies addressing global challenges such as pandemics. Thank you.
Thank you, James. Can you hear me?
Yes, very well.
Okay. So good morning, good afternoon, good evening to all. As I understood, we have listeners from all over the world. I will just give you some hints of how space program and technology can be used, because it could deserve hours of discussion, and you had already some hints. So if you go to the next slide, just for those who do not know, do not remember. So UNISA is an intergovernmental organization, 2 member states today, plus a certain number of associate and cooperating states, covering a large part of Europe, and with a budget this year of 6.7 billion euro. We are tasked by our member state to develop a certain number of programs to do research and technology, and develop the applications. And the great chance we have, we are one of the very few, if not the only one, space agency in the world to cover all areas of space activity. And this is on the next slide. It's along 4 pillars, just to, as an easy way to explain what we are doing. So we have the first pillar, that is science and exploration, so astronomy, planetology, human spaceflight, microgravity. The second pillar is a new small one that was adopted by our member states end of 2019, that covers space safety, or what happens in space that can harm satellites or harm the Earth, all what is linked to cyber security, and what is linked to security on Earth, following disasters and so on. The third pillar is the classical applications pillar, with Earth observation, navigation, and telecommunication. And the fourth pillar, you can click once enough for the animation, is enabling and support, because of course, to be able to have all these satellites, we have to be able to have launchers to operate them and to have technology. So really encompasses all the topics. You can go to the next, Emma. Yes, and we are addressing basically 3 main areas as a categorization: the society and the citizens, and all instances, the economy, and helping developing the economy, in particular of our member states in terms of space economy, but also developing economy at large. And for the environment, it both also the Earth environment itself, the global climate change, and the Earth environment with all the debris and so on. So these are the 3 areas that we are tackling. On the next slide, you will just see, just to show that member states have confirmed end of 2019 that indeed we were not only tasked to develop satellites, but also make sure that they would address a certain number of societal needs and challenges, including, for what concerns us today, the SDGs and global health, but many others. And this is really a task of being useful there. On the next slide, This is something that we started just before the SDG were adopted, looking at sustainable development. And of course, when they were adopted, we just attached our activities to the SDGs. Because what is important is that space program can address one way or another all of the 17 SDGs. They can address it by the image of the thermometer, so measuring what's happening, but also bringing some medicine or some solution to the goals. Space will never solve everything. Space will never be the answer, but it will contribute to it. And in order to help those that are not at ESA to find some possible answers, you can go to the next slide. And you will see that we have developed a catalog that is online and available to all, where we have identified today more than 700 examples of activities, programs, technologies that can serve one or more of the goals. You can go on this catalog, you can download any type of extract you've done, you can select on SDGs. And I will now concentrate on some examples that are linked to SDG 3, so the health and well-being, and both existing activities, but also some that were put in the frame of the fighting against COVID-19. So the next slide shows just not to forget that human spaceflight is a contributor to health on Earth for the elderly people, for medical apparatus or surgery diagnosis, for disinfection of hospitals, so something that can be useful in these days, for monitoring the health status. When you are able to monitor the health status easily, you are able also to use the same type of apparatus you see on the right, used for the return of astronauts when they just land in the middle of the desert. You can use it in any remote area to monitor vital parameters of the people, and you can easily implement it everywhere in these times where many people are ill and you have to monitor. And the next slide shows something that was developed some years ago for the Ebola crisis. Yes, that was deployed again in Italy, in Piedmont, to test quickly key workers, so that the key workers like healthcare, civil protection, emergency services could be tested in matters of minutes of hours to be able to go back to work very quickly if it was confirmed that they were not infected. And this was using satellite telecommunication so that it would communicate permanently the results to where needed. And also they can use some Earth observation images to map to do epidemiological mapping when it is needed. The next slide is an initiative that was started specifically for COVID with the European Commission, that is called RACE, Rapid Action on COVID-19 and Earth Observation, that defined the use of Earth observation satellite that we have in Europe, so the family of Sentinels, but also the other one we have, the Earth Explorers, to be able to measure a certain number of parameters, and this can go back to some of the previous speakers. If you go to the next slide, this was done over Europe, and you can see the number of cases that were done with a certain number of measurement of what was happening in the frame of COVID. So, for example, air travel reduction, so there were counting of airplanes stationed on the airports and not flying, counting on cars, in that case, not of hospitals, but in commercial places to assess the impact of COVID with the closing of commercial area. So reduction of economic activities. And the next slide, it's another example linked to health, which is the measurement of air quality over the time. And I chose Vienna because UNOOSA is headquarters in Vienna, even if today we are all over the world. So this is a way by which a certain number of parameters could be measured and see the effects of COVID measure, of quarantine measures, or reduction of activity. On the next slide, these are just two examples of initiatives that were taken, one with the support of UK Space Agency, one with the support of the Italian Space Agency, with call for ideas on how space and satellites could help bringing a certain number of solutions. On the left, the 3 projects that are starting to be implemented with the UK, which is using satellite telecommunication to do secure air corridors for drones and deliver blood samples, COVID tests, protective equipment. And the interest is that it would avoid land transportation and so some staff to transport it, reduce physical contact, minimize the risk of secondary transmission of the virus. So it is something that is put in place. And there are some other examples. And the example on the right is so developed with for Italy, following also call for ideas. It's the idea to develop videos for the young people, the children and the young people, to help change a perception of the pandemic. And the interesting feature is that satellite navigation was so that the content of the video is adapted to the location where they are and to the pandemic conditions or to the quarantine conditions that are seen locally. So that the video is not just one film, it's a series of small videos, a series of things that can be targeted to the place where the young are and the situation they will see. And this project also are developing a certain number of tools in order to help streamlining communication in the health system. So the way how existing satellites can be used to tackle and to adapt to certain specific conditions. The next slide is also an example of what was developed. As everywhere in the world, the physical meetings were just stopped. And webinars were developed, and a series of webinars was developed around the COVID-19. This one was a discussion on healthcare, but on the next slide you will see a series of 5 that were developed with experts each time. So on the next slide you will see that there was one on pollution, the one on healthcare that you have seen. So the next slide, please. One on education and how education was changed with the COVID and with the measures around the COVID. One on working conditions and evolution of working conditions, and one on the business model itself. So the idea being to have experts discussing how they have adapted their way of working and how satellites can help or not on that. And the next slide for me, just to say that if you want to know more, you have, of course, the catalog I mentioned, but we have also web pages on the internet, including web pages on health and web pages on sustainable development. And you can find on these web pages all the news articles on ESA activities or supported by ESA activities that have a link to these topics. So I had to be short today, and still, if you want to know more, you can find a lot more. Of course, a lot of what we are doing is targeting Europe in terms of, for example, developing satellites is for European industry. But the use of the satellites and the applications and services and technology can have a much wider use, and we have partnering and discussing with many in the world. The catalog, as was mentioning, we hope that soon it will be embedded into the compendium of UNOOSA, so really working at international level also. Thank you.
Thank you so much for your information and clear examples of current activities and resources available to us in the use of satellites and space. Again, we'll look forward to some questions at the end of our session today. Our next speaker will be Radu Botez from UN SPIDER, United Nations Office of Outer Space Affairs. The talk will concern cataloging space-based applications related to COVID-19, the UN SPIDER Knowledge Portal as an information hub. All right, take it away.
Thank you very much. Good morning, good afternoon, good evening, everyone. So from one catalog of solutions, we're going to move to the next one. I will be speaking about what we, UN SPIDER, have been doing, especially related to knowledge management around contributions of the space community, space-based information applications that support COVID-19. Next slide, please. Just as a bit of background, I'm sure that most participants here are aware of what SPIDER is, but a quick refresher, we are the United Nations platform for space-based information for disaster management and emergency response, established at the end of 2006 with the mandate to provide universal access to all countries and all relevant international and regional organizations to all types of space-based information and services relevant to disaster management to support the full disaster management cycle. And this last bit, just to underline, we are looking at prevention, preparedness, disaster risk reduction, as well as emergency response and reconstruction. And we are working quite a bit with disaster management agencies, and we are indeed supporting them and really tapping into the wealth of data, of applications, of methodologies that now exist out there to make use of space data for disaster management. Next slide, please. We also, as in the previous presentation, have four pillars that we work on. Technical advisory support is something that we do through different formats. We typically conduct missions to countries where we will look at how space-based information is currently used in disaster management. And based on those findings, we will make recommendations that we will follow up on through what we refer to as institutional strengthening missions, which are really follow-up activities that might consist of specific trainings, for instance, on specific data, such as radar data for flood mapping or other type of data for addressing other hazards. So this goes indeed into capacity building, which we have, of course, now done a lot more online. So we are regularly running online trainings on the use, especially of what we refer to as UN SPIDER recommended practices, which are step-by-step procedures on how to download, process, and map space-based information in order to develop information products that can support all phases of disaster management. So, for instance, we were doing an online training on how to use Google Earth Engine, a cloud-based application for developing flood maps and assessing damage with various data sources. We do, of course, foster cooperation and exchanges, and this conference is an example of that. And what we also do, and I'm going to go into more detail on that last pillar, is knowledge management. We have the UN SPIDER Knowledge Portal, that is an online hub for discovering information related to the use of space data and disaster management. And the Knowledge Portal, which has been online now for some time, and attracts an increasing number of visitors every month, is really the gateway to space-based information for disaster management. Next slide, please. So when we look at knowledge management more generally, there are different phases that typically are mentioned as the knowledge management cycle. So we speak about discovery and access, and that is indeed something that, given the noise out there on the web, we type something into a search engine and we get results, and we have to go through the noise and find what's relevant. And that's something that is becoming, to a certain extent, increasingly difficult. What we're trying to do with the Knowledge Portal is basically helping those that look at natural hazards, that respond to disasters, in finding relevant data sources, software, as well as methodologies. We do, in this context, a bit of assessment and of organizing the content so that it is relevant and that it can be easily discovered. And then we also indicate how certain data sources could be used, in this case reused, or how new information products could be created based on available data. And then we, of course, encourage sharing, exchange of information, also regularly recommending the establishment of national spatial data infrastructures in countries we work with, just to encourage that all of this, that there is a constant information flow. Next slide, please. So as I said, the Knowledge Portal is a gateway to space-based information. We have regular updates about what's happening in this area. We have background information on space technologies as well as on disaster management, so that both communities that we try to bring together find relevant content. And then we include a bunch of examples so that we also show what can actually be done with this. And I'm highlighting here on the right-hand side a couple of elements that are quite, I mean, let's say simple in the sense that these are filters, but these underline why or how, in this case, we're trying to make content easily discoverable. So we're systematically trying to categorize all the content we have with regards to the hazard that it relates to, just to basically make it easier for someone to find data that is typically used for flood mapping. We also, as I said, cover all phases of the disaster management cycle. And that's, again, something we attach to each and every piece of content. And slowly, over the years, this has developed a net of information, really a network, where different items are related to each other. So it also leads users from one place to the other. And it's not only saying, well, there's a data set, and here's the link to the original source, but also here's how the data set has been used. Here's how you could use it. You need, some examples of some tutorials to use it. Here, links to those. So we're trying to bring all of this together. If we move to the next slide, please. The idea being that we want to move through the process of going from data to information to knowledge to insights to wisdom, a concept that initially was formulated at the end of the 80s, but we are trying to move through this process. There's data, we are categorizing it, we're also linking it. And we do hope that through these links, we are basically supporting the development of insights and, of course, ideally wisdom. But the idea is that given the data we have and the wealth of products that's out there, there's a need to relate them to each other so that they become valuable. And this brings me to my next and last slide. And this is actually then how all of this was implemented in practice in order to highlight what's being done by the space community, but also by the research community on COVID-19. So earlier this year in March, we set up a page where we started to collect examples. And we took the approach that I outlined before, which is to say we would like to categorize to make sure that we're not necessarily listening. This one, please. Yeah, thank you. So we're not necessarily only listing the resources on a page, but we're trying to relate as much as we can to different elements. So we've looked at, okay, what type of products, data sources, and so on are there? How can we categorize them? How can we relate them to other content? What's the scope? So we've seen a lot of information products that aimed at increasing situational awareness. So that was one of the categories we set up. We've also seen a lot of research opportunities, funding opportunities, and we thought it might be good if we can surface them, if we can make it easier for the interested public to actually find these research opportunities. So we've added different elements. We have, I think, around 80 examples. In those also some that were presented in the previous presentation. And we have implemented a couple of filters and a couple of ways to actually easily find them. And we're also looking at how all of this can be related to existing content. So really the idea here was to create a repository, to take an approach that really puts knowledge management at the heart in order to make it easier for users, for the public, for those that are looking for examples, that are looking for resources to find them. And with that, I would like to thank you. And thanks.
Thank you very much, Radu, on your information on the cataloging applications. Of course, it's much more than that. You and other speakers talk of our wealth or overabundance of data and information. We also have addressed the issue of creating ethical policies and positions surrounding that information. We have too much data, and we need to integrate it with space technology. Professor Brooks used the term or phrase data fusion. We must find a methodology or platform that can accomplish integrating all of this data and hopefully get to what you have just called wisdom. Our last speaker for today is Marcus Henenkel from Perigee and Harvard Humanitarian Initiative. He will speak on forgotten crises, unlocking the power of Earth observation through social analytics. Marcus?
Good afternoon. You can hear me. I hope you can see this.
We can do both.
Okay.
Oop, your microphone is cutting out, unfortunately.
I hope that's better. We are a tech startup that's been established in 2019, and we're currently funded by the European Space Agency and Research Promotion Agency. That's the World Disasters Report that came out last week. You'll see a number of different events from but of course, there are that we haven't even heard not knowing about, and there is no humanitarian need, of course. Everything is overshadowed. Compounds have become a complex issue. So this is just one that links the one disaster category to many more people need it. Food shortages match the pop of a earthquake or of an eruption. So what we ultimately care about, so we want to understand how emergency information from Earth and text links to people's behavior on search engines, how it links to and international news, how it links their behavior on social media. One thing that we've learned over the last months is that the true power of information lies in the co-design of that's intriguing lack socioeconomic context, but there are other data sources, satellite data, to develop a service that can directly be integrated in existing workflows. So one is what if a public emergency management system is not activated for the emergency, for the disaster I care about, as the fundraiser, as the emergency officer, as the cost officer of a humanitarian agency. And so if you look at the current CMS, the current emergency management service, this has been active since 2012, and we've seen more than 400 activations, which is a huge number. But compared to the 439, there were more than 4,700. So it could easily be that you are an aid organization about about that is not part of an activation of any kind of emergency management service. So what it ultimately comes down to is the link between internal technical capacities and third-party solutions for data. Their own sector, third-party solutions. And another thing that of the focus group interviews that we had over the last year, on the 10 added value, like this super granular, highest evidence of disaster impacts, because evidence of disaster impacts can be regarded as the proxy actual funding. So just a few words about social interest and the way we treat Earth observation data. Because our specialty is mainly the use of Earth observation to figure our social analytics. We know that the social media analytics and new internet analytics of the disasters. However, we are living in a globalized world, right? And in many cases, the donors, the private donors, stay in different countries than the ones where we are seeing the most severe disaster impacts. So ultimately, observation and emergency reports, together with auxiliary information, economic information, with stat information, and with information from social media, from internet use, and from people's online search behavior to measure and predict interest. Because ultimately inform campaigns, this can ultimately inform the actual operational activity of aid organizations. So, usually mean when we talk about actionable knowledge, is, as previous speakers have framed it very nice, the translation of data into some kind of actionable knowledge. So a few key questions that's conversations with humanitarian decision makers over and over again. First, where do I find evidence for the disaster that I care about, for the disaster, for the hazard component, for the risk component, and for the actual disaster impact? The second one, well, the second one is a lot harder. So what if you have different text-based, report-based, or EO-based sources of information that contradict each other? And ultimately, people want to know if there is already a public interest for the event that they're planning to run a campaign for, or to start an actual emergency response program. And if there's no public interest, how they can generate it and how the generation of interest can be monitored. And so one of the first events that we looked at was Hurricane Amanda. Because a few days before the cyclone hit Central America, be aware that things get worse and that the tropical cyclone wouldn't land, and this could potentially lead to damage. So first thing we will look at to the event in El Salvador in June 2020. There was a high interest in research coronavirus and the weather. But around the time that people realized that there was an early warning coming up for the cyclone, to coronavirus, and that was just the signature. You can be very granular when you complement the Google search trend information with social media and with news information at the local scale, but also regional, global in Europe. So when you look at the spatial segment of Google search trends, it was very interesting that most of the people in Guatemala outside the capital prioritize the search example, but the capital they still coronavirus during the time that the country had been exposed to the tropical system. Then, very interestingly, an emerging national service activated. This was actually better by China's Ministry of Emergency Management. So we basically tried to integrate such information together with everything else that we could pull out of the web, out of social media, and out of channels to package it in a way that humanitarian organizations could. That number of articles mentioning the tropical storm around the world. You see a very clear signature when the storm hits, and then a slow decrease in the number of articles, and then again a peak that was even higher a few days after the event. Also very interesting was the number of tweets, Twitter volume by country, where El Salvador, the count in Twitter volume was by far highest, followed by the United States. And also, if you look at the number of people who actually engage with any related to this topic, you see you are able to prioritize different for emergency communications, for emergency fundraising campaigns, and deprioritize others. For instance, if you look at Central Austria, running a campaign for this event in Central America wouldn't have had very good chances. So the critical gaps that we're actually trying to close with politics that PRG provides. On the one hand, we realize that when you talk to emergency managers and the way that inform the source when it comes, they have many operating systems. They link into different APIs. They link into different RSS feeds. And so we learned that it would be very relevant and very important and very beneficial for them to have one central dashboard that does not only include either one source of information or one type of information or other, but to give them a lot more flexibility with regard to what kind of information they would like to see harmonized, contextualized in one dashboard that exactly fits their needs. Second point is that, as we heard earlier, there's an abundance of information. There's more than 500 to 600 million tweets sent out every day. There's more than 6 billion searches performed only on Google in one platform in one day. So understanding how these different of information relate to each other contextually, spatially, and temporally can be a huge added value from the perspective of humanities. So economic component to existing static the decision support among the humanitarian actors, and ultimately, this is something that we're getting into right now. There's a huge added value inside of storytelling. From a tropical cyclone resulted in large region, and we learned that simply showing the inner area with a reference point is a very simple trick that can help to engage people. So just showing that this is a huge red area where the surface of the planet is inundated, not as powerful. This is approximately 3 times the size of Vienna, which is around 400 kilometers. So to wrap things up, what are the next steps? And with disaster, we need to understand that the popularity of an event does not at all reflect the severity, the local impact, and that again is not a good for actual funding needs. We realize that although of course more popular, it's often it's very easy to generate a lot of funding, and in many cases these events are overfunded, whereas other events are underfunded. And this is again very critical in times where the COVID pandemic is putting additional pressure on regions that are affected by extreme climate events or even other health events. So we learned that there's always a target audience for emergency fundraising, even if it might be just a tiny one. So we're moving more and more towards effective activation of our system, more towards predictive analytics, whereas the code design of our system, the design of systems, so since this is my last slides, have any ideas? If you're interested in anything collaborating, you could working with, feel free to reach out.
Thank you so much, Marcus. You provided a great amount of information and adequately said, it does not end with disaster maps. This is an incredible amount of information that is as yet truly untapped. As had been stated by Professor Brooks, we need to find a way to do data fusion, to find some way to add all of this information to our satellite-based information and provide not only information, but wisdom. Perhaps in our question and answer period, we can address some of those issues further, as well as the ethical questions too. Sharish, how would you like to proceed with the questions?
So Jim, we have already one question and you already talked about it. It's about data fusion. So a participant named Karthik wants to know a little bit more about data fusion, and I think examples Talbot showed were more on the urban side, like hospital, analyzing the number of cars parked during different time period. But if applications are to go towards the rural side in this area, how one can do so? This is kind of question which probably needs some reflections. So probably we can start with Talbot, and then we can take around not only on this question, but in general reflections also. Second part that panelists want to share. So Talbot, are you still there? Talbot?
Looks like he's still there, but here he comes.
Yeah, I'm here. So I think that data fusion is a term that perhaps gets used a bit more loosely than it should. But essentially it is the integration of disparate data sources, and from a satellite space-based technology perspective, particularly as it applies to, say, a rural area, there's data available at different resolutions and different wavelengths, which may be processed towards different products and services. For example, Landsat may be used to do a land use, land cover analysis, or for measurement of NDVI or similar measurement, and its resolution is as good as 30 meters for most of the world. And then there's MODIS data, which may be used to look at, among other things, temperature of objects, but its resolution is much coarser. And so there is the challenge of, if I want to detect wildland fire starts in rural areas and create a vegetative fuel model, I may be working at one resolution with NDVI and land use, land cover data, say from Landsat, and data from MODIS at a much different resolution, and trying to integrate them for modeling purposes. And then I think true fusion starts occurring when I may take those two and have a model and then try to put in geolocated tweets mentioning smoke, right? That's true data fusion in my mind, and bringing those things together. And then especially when we start looking at the relationships between, say, those three and often scores of data sets, and try to use them for predictive purposes, then we're into fusing data to create a new information stream, and one with a fairly well estimated reliability.
Okay, so thank you. I hope this helps to Mr. Karthik, who asked this particular question. It was also interesting. I mean, in the same relation, there's a presentation by Wang Yang from China. He said a lot of applications that integrated several Earth observation data with lots of geographical information system. So Wang Yang, are you still there? I know in China it must be 11 o'clock in the night. I'm not sure. Mr. Yang Wang? Okay, so he's not, it looks, because I think it's quite a late night in Asia, sorry for that. But that presentation also showed a lot of, yeah?
Sorry, can I just say just a few more questions about the data fusion?
Yes, please, Marcus, yes. You are presenting.
I fully agree with what Talbot was saying. I also think we need to be very careful with the term data fusion, particularly when we try to fuse or to merge data are very heterogeneous. It makes a huge difference if you're trying to combine different satellite data at the same resolution that are also mentioned the vegetation indicator, to fuse them index or indicator. That's a completely different story than trying to fuse quantitative and qualitative data, Earth observation and social media. So I'm just trying to, these that we're actually facing in practice. And we recently discussions with folks from the German Aerospace Center that made exactly the same experience. They're trying to fuse data, but the heterogeneity of data is a huge challenge when it comes to qualitative, quantitative performance, default, spatial, temporal resolutions, and so on.
Since Marcus,
yeah, no, I agree very much with Marcus, and it is treacherous, and not to be done casually. Again, that comes back to, I think, what I'd mentioned. It ties back actually to the ethics question, right? I think I might understand it, but I'm not an expert, and perhaps I need to talk to somebody else about it before attempting it, right? So.
Sharice, it's Jim.
Yes, Jim. You have some comment or question to ask? I also have one or two, but maybe after you.
I do have a question, yes. We've talked a great deal today about space technology and its contributions to pandemics, mostly in terms of tracking and monitoring, et cetera. I'm still intrigued by the predictive value of space observations. I was just curious whether any of the panelists would have anything to say about how they feel their technologies would provide us more predictive value on pandemics.
So I'll take a stab at that, Jim. I think one of the very first questions and set of theories being advanced by the biologists, by the virologists, the healthcare community, is why do we seem to see these things arising with greater frequency? We have all these different variants of Ebola that are popping out, SARS, MERS, now COVID, and some of the underpinning theories there are human expansion, particularly into areas where we have close contact with host species, where we might not have otherwise done that, and that's a function of human expansion and global change. And of course, when we talk about global change and human expansion, we're into the sweet spot for geospatial technologies. We're very, very good at modeling landscape change, at modeling growth patterns of human populations, and I think it gives us the ability to really classify and potentially identify areas that we need to have a much higher sensitivity to with respect to emergence of disease, to the point where we could do a better job. We could use these space-based technologies to identify, where do we place early warning systems to help us really stay on top of this. And I think that's half the battle. The other half of the battle is getting people to actually pay attention to those early warning systems and make use of them. It's been particularly in our country, with the defunding of some of the efforts the great partnerships we had with China. I hope to see them restored. But yeah, absolutely. I think that's one way. I'm sure Marcus or some of the others might be able to address some other techniques that can be used. But let's look for where these things emerge. We can do that.
I'm certainly hoping that we are able to use, again, space technology to track the use of the vaccines, since they are now apparently imminent. I'm hoping that information can be tracked as well in terms of getting this stuff distributed as rapidly as possible. Let's see.
If I may, this is Isabelle. Yeah, indeed, there are possibilities, for example, to be able to follow the distribution via sensors that you can put on the trucks or on the vehicles, to be sure that it goes in the place where it was planned to be, to know a bit more how it is expanding. So there are a certain number of possibilities that exist. It's true. Now, will it be needed? Where will it be needed? This is another question. And who will put that in place also? It can be put in place by, for example, the pharmaceutical companies that want to make sure that they will be distributed properly where they have sold it, or it can be put in place by the governments that would like to follow. So it's taking, going back to the ethical question, it's taking the best out of this type of things. When it was mentioned the possibility to use the parking lot in the hospital to see where they were gathering. I remember I've seen that some years ago, it was mentioned in some newspaper that the arrival of the flu, or flu epidemics, a normal one, was just seen with following the research on the internet. And if you combine it with the geolocalization and positioning of phones, you can see which area there are things that are happening. So indeed, there are many things that can be done.
Thank you. Well, I have another question actually for anyone, but perhaps Marcus. We didn't speak much today or at all about the use of drones in our technology in terms of gathering information, current information data. Is that being used currently, Marcus?
In which context?
Well, again, you're talking about gathering all of this information. Mm-hmm. And I just didn't know if some of that was being transmitted through the use of drones, or how you were getting some of this information.
Yes. So I definitely think that there is a huge potential in added value in the use of drones. One practical limitation that we've seen in different countries is the legal framework. Where can they fly? What can they do? Rwanda is one of the greatest hubs for drone technology that I'm aware of. I know that there are operational drone hubs for blood transfusions with different drone ports distributed throughout the country that are operational and not only in a testing phase. And when it comes to actual drone data, when it comes to the imagery that is collected by drones, I mean, one big advantage is that they can be deployed on demand, which is great. That they can achieve very high spatial resolutions. I mean, one thing with regards to their operational value from a humanitarian decision maker's standpoint is that we must not be naive when it comes to the data source, right? So ultimately, decision makers want to know what's going on. They don't care if it's from a public satellite, from freely accessible data, from commercial imagery, from a drone. If it delivers the added value, if it delivers the information that they need for operational purposes, then well, that's your go-to source for information.
All right, thank you.
I just wanted to add that I think Isabel showed some of the upcoming projects that are basically using drones for medicine delivery.
It's not drone for imagery. It's indeed drone for delivering medical products. So it indeed, as was mentioned by Marcus, it needs to have the legal authorization to go in areas, and satellite was used to be able to define and control this legal, authorized corridors. And in that case, it was indeed not to take images, but to deliver, which is another possibility proposed. The limitation of drone, one of the limitations is indeed this authorization to fly. You cannot have it anywhere you want, and there can be areas where you are not allowed, or where it is not safe. So in that case, getting imagery is for satellites more. Also, there is the studies done on HAPS, high altitude observable satellites, that are high altitude platforms that can be positioned in an area for a certain number of weeks or months, and be able to give high resolution image over a certain zone. This is also developed.
Talbot, it's Jim. I'm afraid I'm really intrigued by the whole concept of this being the ethical issues that you addressed. How we can, in some fashion, come up with a policy. You talked about the possibility of coming up with policies or procedures which were standardized for use of this information. Is that happening somewhere in some nation, or are we just talking about it?
Talbot, I mean, okay, Jim will say something, but I just wanted to, there's no answer from me, but for example, International Charter, it has big commitment of providing satellite images during major disasters, and it takes a great deal of, resources for all those data providers to get the images, stopping their commercial acquisitions, cover the disasters, and make the maps and deliver those maps to end users. There is always a question mark that this data is expensive, so there's always one has to sign kind of agreement that we will use this data only for this particular disaster and prevent other commercial use of this particular images. So it's kind of, I mean, it's not a comprehensive way of addressing the ethical use, but I think this definitely gives realization that the value what is being provided us for humanitarian purpose, and make ethical use of that. So this is one example I would just cite at this stage. Over to you, Jim. Yeah.
And Jim, there are organizations that have ethics statements, and they're typically affiliated with licensing and or certification. So, for example, here in the United States, there is an ethics statement that's required as part of certification by USGIF and by GISCI. Both of those are the certification organizations here in the U.S. And they speak to some of the issues that we've talked about or that were presented. But as Suresh had mentioned, UN SPIDER has in place mechanisms that are pretty good, at least on protecting intellectual property and licensing of data. But I think there are larger conversations to be had about protecting at-risk populations from governments that may need our help, but don't always act in the best interest of everybody that lives within their borders. Unfortunately, nation states like that do exist. And so, I think our instinct is to try to render aid and support in a disaster, but that ours is a dual-purpose technology. It can be used to show damage assessment and things like that, but how a government or how a recipient chooses to use or act upon that information when we pass it on is a bit of a different story, and it's beyond our control. But so, you know, again, this is why I'm starting to raise some of these issues, and perhaps it's a separate meeting at some point.
I think definitely we should consider this aspect, not only special meeting, but I think in most also, isn't it?
Yeah, any technology has its positive and negative side. Whatever is the technology, even the simplest one, even any tool can have bad and good use of it. So indeed, it's something interesting. You cannot, I'm afraid you cannot prevent the bad guys to use badly the tools.
Well, I have to admit that never in my wildest imagination did I believe that a pandemic could become politicized.
Okay, true.
I mean, maybe no other nation, but in the US, it has become awful. So.
Yeah, in France, it's more the fact that a certain number of people saying that the government didn't do what they had to do. I mean, making the assumption that they do better, which I would also refrain from saying.
Yes. All right. Shirish, any other questions you see at this point?
I see there is okay, ethical dilemma you address. There is a question on how real-time crowdsourcing can be translated into relief. Probably Marcus will be able to address that. And there's one more: how do satellite monitor protocol observation for tracking COVID-19? Anybody would like to take these questions? Maybe Marcus, can you talk about crowdsourcing, how it can be translated into relief? And I also had one question to you, Marcus. You said that very interesting thing, popularity of events does not mean, it's not linked to severity, neither it's linked to the funding available for that disaster. I also think that probably the language also matters, because all this social media is mostly English-speaking countries are active on the social media, and that language bias can also be one of the factors for this, I feel. So, yeah, so these are two questions and my questions additionally. Jim, you would like to handle this with panelists?
Well, I think you kind of posed the one, at least to Marcus to start. Right?
Yes, Marcus can. Yeah.
Okay, so I'll start with the crowdsourcing. Two different categories of crowdsourcing. One is actual crowdsourcing, where the group and sort of the identity of the people in the crowdsourcing group is not known. It's an anonymous group. The other one is group sourcing. So if you really want to sort of complement socioeconomic assessments that are usually being carried out during emergencies by UNICEF, by the World Bank, by USAID, by many others, and you see gaps in these information sources. There are many companies that offer SMS-based, WhatsApp-based, tailored and targeted group sourcing approaches, where you can have, I guess, a predefined set of questions to, don't know, I'm saying random numbers, like to 6,000 people every 2 months over 1 year in a highly vulnerable region in Mozambique, to complement other, for instance, public socioeconomic sources of information. We also use group sourcing to complement socioeconomic gaps, to close critical gaps in the regions that we are working in. But as we are mainly interested in this, sort of linking into the second question of the popularity of an event, and I fully understand that popularity might be a dangerous word, and the actual funding need. So that's why we're relying on near real-time information from, in many cases, anonymous people. As you might be aware, the data protection guidelines and the legal frameworks in Europe are luckily a lot more strict than in the United States. GDPR is a very hot topic also in the humanitarian tech industry. So we mainly care about really understanding what people are talking about, if they are picking up an event, where the micro audiences are that care about one event that does not make it into the major headlines of a national newspaper in any European country or in the United States, because naturally people in Germany also read the New York Times, and so that's basically the way how we try to decrypt this question related to near real-time information of people that are talking about one particular topic and the humanitarian funding request and the humanitarian needs in the field, because ultimately that's what I meant with co-design, right? It's up to the user and up to our humanitarian users to define an emergency. It does not work that I tell them, well, Copernicus emergency management services have just been activated for one event. Then our users might say, well, that's great that it's been activated, but that's not one of our focus region or one of the focus categories. So ultimately, the user defines the event, and we try to figure out through crowdsourcing and group sourcing where the interest is, to then link it to the emergency information to deliver some kind of complete package to humanitarian decision makers. Does this sort of answer the question? If not, happy to follow up.
Oh, yes, it does. Any other panelists wish to add some comments to that? If no, Trish, again, there was a second question you listed. I forget what that was. I think there was.
Okay,
Maybe
that's
not.
about. I think it's about basic. It asks about how satellites monitor or track COVID-19. So anybody would like to take? I mean, there was a really good presentation by first presenter from China. He showed a lot of examples on how COVID was tracked, but he's not here. So anybody would like to highlight something?
Isabel, just one element maybe. I think when you mentioned the question, it was around how satellite could help following if the measures were respected or not. What the satellite can do or contribute to, because it might be with other means, is if there are areas that are forbidden to the people or area where they are not allowed to gather or they should be limited. Of course, now that many people in the world have phones with GNSS-enabled features, it's a way to assess how many GNSS-enabled phones are active in a certain area. So if the area is not supposed to be populated because of limits, this can give some indications. But it would unlikely be the satellite alone, for example. But it can contribute to the assessment of whether some measures are respected or not.
All right, thank you, Isabel. All right, Shirish, anything else you can think of?
No, thank you. I just wanted to add a comment that normally when we discuss space technology, we are heavily biased towards Earth observation side. But I think some of the presentation, including what Isabel mentioned, it's not just Earth observation or satellite images, but it's a lot about satellite communication-based tools, apps, and technologies, and also satellite navigation related. And now these are the things, they are more contributing to space for health. And there is a really growing interest in putting the space technologies to use in the health purpose. So recently there was wonderful conference, again virtual, organized by European Space Agency. It's called as Space for Intelligent Health. And then UNOOSA, our Office for Outer Space Affairs, also has the initiative called Space for Global Health. So it's not just Earth observation, but a lot of other satellite communication. So I think this particular session has really contributed to these initiatives, and at right time when we are facing COVID-19 pandemic, and I think that's what I wanted to add to this session. So Chair, back to you to conclude, and thanks to all panelists from my side also.
All right, again, I would like to just add my thanks to all of our speakers for a remarkable amount of very valuable and interesting information on pandemics and the use of space technology. I want to thank our attendees also for spending their valuable time with us today. Thank UN Spider for sponsoring the conference. It has been wonderful. But mostly I wanted to say to everyone to stay safe and be well and look forward to the vaccines. Thank you again.
Thank you, G, for your wonderful sharing, and also Talbot, you pitched in when you were not there. Thanks, everyone.
All right. Yes, I do appreciate that. Thanks again. Bye-bye.
Thank you, Gail from UNDRR, who has helped to host this, and Emma, who has been at 12 o'clock midnight to show your slides.
Thank you.
Thanks.
Thank you, everyone. Thanks.
Thank you, bye.
Bye-bye.
Bye. Gail, may close this now. Room.